Good morning. Good morning. Thank you for joining us today. Thank you for coming together as a community as we seek to find common solution to the issues that we counter day in and day out within our communities. My name is Derrick Wyman, and I serve as the co-director of the Renaissy Center for Civic Engagement here at Walsh University. When Walsh established the Renaissy Center for Civic Engagement in partnership with Congressman Renaissy, we did so with a focus on civic engagement. And that is why we gather here today. We gather today as citizens to engage on the complex issues and challenges that our communities face. And we respond accordingly with action and determination to address those very issues. Today, we are breaking the stigma when it comes to the behavioral health needs of our community. We have assembled a stellar list of speakers and presenters who can share with us their insights and work on the front lines of meeting the behavioral health needs of our community. I would like to take this opportunity to thank all of those responsible for putting this event together, including our speakers, our event coordinators, and team here at Walsh University. I would like to thank all those who are participating in the resource fair. If you haven't already done so, please take a moment to visit these great organizations and individuals working on the front lines in our community. Also, I would like to thank our strategic partners, the Stark Mental Health and Addiction Recovery Board, specifically John Aller and Michelle Boone, who supported the event from the beginning. The Akron Bar Association, helping to provide the CLEs for today's event, and Mercy Medical Center for providing the CMEs for healthcare practitioners. If you are here for continuing education, please make sure you have signed in at the tables out in the lobby area. And at the conclusion of today's event, please make sure that you complete and turn in the evaluations. It is now my honor to introduce to you the 6th President of Walsh University, President Richard Jusseaume.
Good morning, everyone. On behalf of the Walsh community, we welcome all of you to Walsh University. Some of you we've seen here often, and some of you are first-time visitors. I encourage you to feel free to roam the campus. You're not allowed to do that, of course, during our sessions, but in between, afterwards, go visit the new Global Learning Center across the quadrangle and make yourselves comfortable on our campus. Sometimes the path to getting somewhere is quite circuitous. We seldom get somewhere in a straight line. So let me tell you a little bit about today. Once upon a time, there were two people who grew up in Louisville. Their names were Gary and Linda Byers. It appears that as soon as they could, they left Louisville, but they also left family behind. And at one point, Linda Byers thought, wouldn't it be nice to honor my mother, Helen Irene Peer, with a nursing scholarship at Walsh University because she had been a nurse. So they established a scholarship. Well, then they thought, and by now they're in Chicago, Florida, points north, south, east, and west, if we're going to have a scholarship to my mom at Walsh University, of course they have a wonderful nursing school already, but we got to help take that to the next level. So all of a sudden, on campus, we had something called the Gary and Linda Byers School of Nursing. Well, after that, they thought, now wait a minute, Walsh is opening this new Global Learning Center, and within it, there will be the Renaissy Center for Civic Engagement, and in the Renaissy Center for Civic Engagement will be an Institute on Community Health. We really ought to be part of that as well. The common thread from Louisville to this morning is, of course, Linda Byers. Would you please welcome her? From Louisville, we jump to California, just down the road to the west. And Derrick and I are visiting Judge Richard Loftus, who was a fellow student of mine in the 60s, if you can believe. I know we don't look that old, but we actually are. And just for the record, he's older than I am. He was a year ahead of me. And while talking with him, And talking about his work there with the courts, he told us about an initiative he had helped to launch, the first ever mental health court in the state of California. And as he kept talking about that and the issues and problems that came with that, it just made sense for us to invite him here and share with all of you some of what is being done and obviously some of what can be done. We're here to talk about serious issues. According to the National Institute of Mental Health, nearly 1 in 5 adults lives with mental illness. 1 in 5. According to the National Institute of Drug Abuse, Ohio is among the top 5 states with the highest rates of opioid-related overdose deaths in the country. You already know that. You're the good people out there who are dealing with this every day, trying to make a difference. And if no one else does it again today, please know that we are very grateful and thankful that so many of you, personally and professionally, have given your lives to making a difference in our community and others such as you around our country. Well, you don't need more statistics from me. Let's get on with what we think is going to be an interesting day that we've planned for you with some very knowledgeable and accomplished presenters. At this time, it is my honor to introduce Walsh University professor and the director of the Byers Family Institute for Community Health. Please welcome Dr. Leigh Murray to the podium.
Good morning. If I was in class, I'd have you stand up and do some jumping jacks, but I'll refrain today. President Jusseaume, thank you. I just want to speak a little bit about the Institute for Community Health and what it is and what its mission is. And we'll have a little bit of a discussion at the end of the day as to how you, all of you in this room, can contribute to that. Okay? So the Institute was newly established, and its focus is on the health and wellness of this local community, nationally and globally. So it has a lot of different areas that it could have a big impact on. Its mission is to promote healthy living and community wellness through research, education, advocacy, and service. So in order to achieve this mission, we encourage interdisciplinary collaboration between our faculty, our students, as well as partners within the community. And that is local partners, national partners, as well as global partners. So I encourage you today, as you listen to the panels this morning, to our speaker during lunch, try to think of the way that you, your profession, or your organization could have an impact, especially on the mental health epidemic that we're seeing in Northeast Ohio, in Ohio, and on a national level. Because we'll have some mechanisms for you to actually get involved, to share your ideas, to get in touch with the people involved with the Institute, so we can connect you to people on campus through our faculty, our students, so we can kind of be a hub and be a central location to make those connections between the people in the community and the people on this campus that could actually probably play a role in coming up with ideas and coming up with ways to address some of the issues that you may hear about today. Okay? So we'll get into the meat of today. I'm sure you're tired of hearing all the people from here talk about why we're here and so on and so forth. So I'm going to introduce Judge Sarah Leoy. She's a native of Canton, Ohio, and has a Bachelor's of Arts from Bowling Green State University and is a graduate of I've been told, the Ohio State University College of Law. After a successful career, I'm from the South, so I just had to make a little dig. After a successful career as an attorney and as a common pleas court judge, she was appointed to the United States District Court by President George W. Bush in 2007. In addition to her outstanding record of public service, she's also the chair of the Walsh University Board of Directors. So let's welcome Judge Sarah Leoy.
Thank you, Dr. Murray. Good morning.
It is my pleasure to serve as the moderator of our panel of 3 judges who will share their experiences working in the courts with persons who have a mental illness. In many cases, the individuals who have appeared before these judges also have co-occurring substance abuse disorders, so the judges have had to consider the unique needs of each individual in crafting proper dispositions. All 3 of our panelists have worked with persons who have mental illness in the criminal justice system, and one of the judges now works with persons with severe mental illness who have been civilly committed and are being transitioned to outpatient commitment. So each of our panelists will bring their own perspective and experience in addressing how mentally ill individuals are treated in the courts and discuss ways in which we, as a community, must come together to support these individuals so that they can successfully function in our community. The format that we will follow is that I will introduce each of the panelists, and they will give an overview of their experience and the programs with which they have been involved. When all of the presentations are concluded, we will then take questions from the audience, and you may either ask your question from microphones that will be made available, or you may write down your question and hand it to one of the facilitators who will then, in turn, bring it to me. We will hear first from Judge Richard Loftus, Jr. Judge Loftus attended Walsh and earned BA and MA degrees from the University of Detroit and a Juris Doctorate from the University of Michigan. He retired from the bench in 2016 after 18 years as a Superior Court judge for the County of Santa Clara, California. His work as a judge included criminal, civil, family, juvenile, and drug and mental health cases. For 7 years, he was chair of the Mental Health Issues Implementation Task Force and the Task Force on Criminal Justice and Mental Health, a task force appointed by the California Judicial Council to change the treatment of the mentally ill in the justice system. Judge Loftus has been an active community servant, serving on many boards, including the Domestic Violence Council of Santa Clara and the United Way of Santa Clara County. He has received many honors, including the Words to Deeds Judicial Champion Award from the Forensic Mental Health Association in 2016. Please welcome Judge Loftus.